you consider from having doulas, would you consider them useful or a waste of money?
A waste of money. Me in particular, because, okay, so I actually asked my friend this morning before calling into this Zoom chat. I asked her permission to share this detail because my friend who birthed with my midwives right before I got pregnant with my son, she had the same doula. Now, this doula has been present for both of the confirmed deaths with my midwives company, both of which happened after my friend had her baby. Now, my friend, this doula is also like a prenatal yoga, prenatal massage person who owns like a whole pregnancy, full spectrum wellness place for pregnant people. This doula and my friend became, they established their client and doula relationship because at like 34, 35 weeks pregnant, my friend went in for a prenatal massage. And the doula was asking her, who's your doctor? Because she started talking about, she was like, I know I'm getting closer to the end and I just feel like this baby really wants to stay put. I'm afraid of being induced. I'm afraid of having a C-section, that kind of stuff. And this doula basically was like, well, I have had clients who worked with your doctor and he is no good. And he makes dangerous choices. He makes unsafe decisions, yada, yada, whatever. So then she convinces my friend to have her consultation with my midwives. And then my friend has her baby with the midwives, and how her baby was born, it's her story to tell. She is not happy about her experience with the midwife, and that's all I'll say. There has been a little bit of a point of contention between the two of them since my son died, because my friend is like, I don't understand how you can still work with this midwife. You've watched 2 babies die with them before. And just a couple weeks ago, my doula said to my friend something along the lines of, well, your doctors know better. I watched him invert a uterus once before. Which just brings me that study that we talk about sometimes in the VBAC group that was conducted in the UK that says home birth is much safer because there's less frequency of adverse outcomes in home birth, but they don't discuss that the adverse outcomes, they're ranking death as the same thing as like a broken clavicle from shoulder dystocia. So while certain things happen in hospitals more frequently, like shoulder dystocia or a laceration because a baby's face is too close when they make the incision for a C-section, things like that, my doula literally thinks that a woman having her uterus inverted because of retained placenta and a doctor's attempts to get that placenta out of her body is equal to or more than the death of 2 babies that she saw with her own eyes. So for me and the doula that I had would not be worth my money. There is a local doula around here who I do think is probably worth paying. And I will be honest, part of the reason that I would say she would be worth the payment is one of the other things we talk about in the home birth, or not the home birth, the VBAC group, is if a doula is really there to do what their job says, then their compassion and their kindness and just wanting to be there as your friend, they shouldn't be charging you money. Because how do you take someone's money to be their buddy? This doula, we had no professional relationship established at all. The only time we had ever spoken was when I was pregnant with my son looking for a doula. She was one of the people that I had kind of like messaged on Facebook, but then my midwives were like, you should work with this doula, you should work with this doula, and like kind of forced my hand into the doula that I wound up with. Only after she had been there for the death of the other baby though. This other doula, she and I had spoken, and she has said to me, she was like, I'm so devastated by what you went through that I will not ever, like, I've had clients who decide at 39 weeks, 5 days that they don't want to deliver in a hospital, and they go to your midwives, and I fully reimburse them their money. I will not step foot in there. I will not work with your midwives. And when I told her I was expecting again, she was like, I just want to make sure you're okay. And I want to make sure you feel supported in your decision making that you have this pregnancy. If you're looking for a doula, I want to be your doula free of charge. So she was going to do my whole pregnancy and everything with me. And she's also like, a couple of our hospitals have like pictures on the wall where it's like doulas of distinction, where the hospitals are like, these are the good guys, work with them. And she's like predominantly featured as one of the most medically supportive, like, I'm not going to get in your way. I'm literally here for ice chips and sandwiches and to tell you no matter what, you're brave. And so there are some, but I think that it's kind of like picking a home birth midwife, where maybe there are some out there who respect the limitations of their job. And maybe there are some out there who understand the position that they're in when they are taking on that role. And maybe there are some who will help you make the safest decisions, but it's like trying to spot a fake designer bag if you've never held a designer bag before. Like, you don't know. Like, I could never tell a Louis Vuitton from a fake Louis Vuitton. And that's like doulas and midwives. Like, I can't tell the pieces of crap from the ones who genuinely respect their job and the value that they have. So it can be worth the money. For me, nope. Even not paying them, it wasn't worth it.
I didn't pay for my doula because she was attending births as part of like the training aspect to become certified. So she was like a doula in training. She was not. So she got trained through a different one. I'm trying to think of the names of like the different training networks, but it was not the most common one. Is it like Dona? It wasn't like that one. It was a different one. And she's talked to me since then. She's actually still like, she's remained in my life, and I still talk to her quite regularly. I would definitely describe her though as the exception to the rule of how doulas are. So in general, if you ask me that question, no, she's largely stepped back from doing that. She doesn't use, I honestly think that seeing my birth during her doula training was eye-opening to her. She even like discussed, obviously not my personal detail, but like described my birth to like that she'd attended to doulas around her. And she came back like to my postpartum check-in, and she was like, yeah, the doulas that I was talking to talked about like how maybe your epidural could have caused your rupture, which is just like, no, nope, that's not it. Like, and they're so like, they were so reflexively just trying to identify what me as the birthing parent did wrong to contribute to like why I would have ruptured. Like it was very clear to me. And I think it became clear to her very quickly, because she was truly like, this doula in training and trying to be like, whoa, Megan seemed like such an unlikely person for that to happen to. And I'm just trying to wrap my mind around how that happened, and that was really traumatizing to watch. And they were kind of just like, well, let's run through it and find out what she did wrong. And like, they really were. And basically anytime it was like, well, I bet if she just felt more, at home and, she felt more natural and she didn't have fetal monitoring and she didn't have all of these things. I bet if she was just more relaxed, like her labor would have progressed and that wouldn't have happened. And they were saying things like that. And I think she was kind of like, whoa, because like she was there. And I think that like her hearing that from her colleagues was a little bit of a red flag to her. And then she went on a year later she had one baby at that point, and it was a C-section, like a failure to progress C-section. And she had a baby a year after my birth, and she delivered in a hospital. fully monitored for her TOLAC. Because I mean, here just a year before, she had attended my birth as a doula and seen that happen. And so she had all the intervention, I mean, she had all of the precautions you would have for a TOLAC, and she had a successful VBAC, but like right after her baby needed a brief NICU stay for an issue with his lungs. And it was one of those that like quickly, like he came out and then like wasn't breathing normally, and they had to like really like whisk him away and work on him. And she was like, that was absolutely terrifying. And I just think Megan, she went on to tell me, like, I don't know what would have happened if I was home in that head, like, she'll still say that, she supports a woman's choice to birth where she wants to go and what she wants to do. And she's like, I've been at home births that have been beautiful, and I've been at hospital births that have been beautiful. She knows that I support women's choices, but that I don't support home birth. And she knows that. And she definitely wouldn't like recommend it. She's definitely, though, again, the exception to the rule. And I actually think I have a sense that her life has just gotten busy and she's pursued other avenues. And I think birth is still something that she's passionate about, but I do think she's become a little disenchanted from the natural childbirth community, having experienced medical complications herself and then witnessed them in her scope of being a doula. And she's human enough, unlike some of those other doulas that witness it and just are like, meh. It bothered her, and she still thinks and tells me to this day that she thinks about my delivery and everything like that. So no, I largely do not think that they are worth the money, also because they charge really, really high prices most of the time. And I don't know though, but I do think that there can be a place for ones that do stay in their lane, but then how do you know that they stay in their lane? Like, I actually do think, I think of primarily, so I'm kind of fragmented all over the place with my thoughts right now, but I do think a lot about how they get kind of presented as a Band-Aid fixing issue for women of color or birthing people of color to the obstetric crisis around that, when that's not going to be a solution. But I do think they could be a tool in the toolkit if they stayed in their lane. Now, if they're encouraging women of color or pregnant people of color who are delivering to do stunt births, and that, you just need your intuitive instinct outside of the hospital and you need to extract yourself from the system. No, I think then they're dangerous. But if they're, staying in their lane and they're just another support person in that room, I think that they could be a tool in the toolkit. But again, as you were saying, Madison, that's really unpredictable. It's really unpredictable of, are you getting a doula who has these self-serving reasons, and are they viewing themselves as some sort of savior to this solution? All sorts of things like that. So I've often thought about, like, and I don't know, I just know that I could never fit in with it. But after I processed my trauma and got to a better place where it wouldn't have been reactionary out of trauma and thinking of I'm just going to trauma bond my way through this. Once I processed my own trauma and got to a better place, I thought about I feel really passionate about helping women feel okay with their choices around things like proper pain management and normal intervention and things, and just feeling okay about that and supporting them through birth. However, and I thought I wonder what role I could take on in that way. But the doula, how you train for it and the people you're around and everything like that, it just doesn't fit. You have to be this rogue doula who supports medical models and things like that. And so I just never, I'm like, no, that's not for me, because I could never fit in with that. But I've thought about how could I partner with hospitals? How could I work within hospital systems and be almost I don't know. I've thought about it. I've brainstormed 18 different ways that I could make it work, because I actually think that could be really beneficial. And I think you could see positive outcomes from someone who is in that role. But who are you going to attract to get it? And I feel like I would be a unicorn amongst a bunch of people who are, have other intentions or self-serving motivations. And I don't know. Those are some of my thoughts. Overall, no, I don't think doulas are worth their money.